the lips. Hello. So today we're gonna do lip flip. That's just a very quick procedure. Wipe off with some alcohol. And it just takes a few units of Botox. You're gonna get a little pinch. And we're gonna just a couple units, maybe. Might have to You okay? Mm-hmm. There we go. That's it. And so what it will do, once the Botox kicks in, basically it will not allow the lip to go under. So when she smile, you can see the lip kind of trying to curve under. When the lip is working, it's gonna try to help to pop the lip up. And then we're gonna do some fillers at some point to fill the lip up so she's not gonna be able to curl it under. None of that.